viewers, a warm welcome to Nextillo. The wonder has a name. Nextillo, your one-stop destination for all your medical learning needs, all under one roof. Orthopedics is something that we've heard or seen a lot about orthopedics as a subject through multiple resources. Orthopedics is a medical specialty that deals with diagnosis, prevention, treatment of the musculoskeletal system that deals with and includes bones, joints, ligaments and tendons, nerves, muscles, etc. Today, let's take a deeper dive into what is orthopedics as a subject, what orthopedic doctors do, the condition that they treat, and what are the tips and suggestions that a medical student should know more about while facing the competitive exams more on orthopedic subjects. So today we have Dr. Pawan Dhawan with us, the Faculty of Orthopedics with Nextillo, to share some interesting facts and details on orthopedics. Welcome, Dr. Pawan. How has your journey been so far with Nextillo?
Well, it has been a good experience and this has been a great initiative. I really appreciate the effort. This is going to go a long way into helping our graduates to reach new heights, and I'm sure this is also going to help them decide which faculty they want to choose further in their careers, because they are going to be introduced to the subjects in depth like never before.
Absolutely. Thank you so much, Dr. Pawan. First of all, we are really happy, and it's equally a pleasure to have you as one of our faculties for this crucial subject, orthopedics.
Thank you.
You're welcome, sir. One of the questions that is commonly heard by our students is, why is that orthopedics is considered to be one of the most popular stream as a choice for the students while choosing the specialty?
So there is no good single answer to this question, but I think one of the most important reasons what I think behind this lies is the fact that, you see, in orthopedics we are dealing with patients who are non-ambulatory, who are perhaps bedridden, who perhaps have conditions such as fractures or some other pathologies of the bones and the musculoskeletal system which are not allowing them to ambulate. Now, once you take down ambulation from the life of a person, it is as good as a bedridden patient.
Quite difficult, yes.
Indeed, they are non-productive, they cannot resume their careers, they cannot work in their homes, and their livelihoods also suffer. So it is a very tough situation to be in for anybody.
Yes.
Now, as an orthopedic surgeon, what we are trying to do is facilitate that mobility. We are trying to treat those patients in a way such that they can resume their activities, they can ambulate again, they can get that part of their life back which has been snatched.
Great.
And once you are delivering that, once you are revocating those people, once you are allowing them to resume their jobs, resume their household work, you are actually giving, in a way, I think, their life back to them.
Wonderful.
So that is something which I think attracts many people towards this branch, because the gratification of doing that, and after so many years of hard work and all the toil which you have done to reach here is indeed something which is beyond words.
Beyond words. Wonderful. So you mean to say that when you're helping a person to recover back to his normal life,
yes,
the kind of satisfaction that you get itself is something that is pulling you to select the stream. Wonderful. That's a great reason to choose this stream. So one of the most common questions that most of the patients who are elderly or probably the age group 40 plus have this question, that how do we handle or avoid the orthopedic issues?
Yes. So again, there is no single answer to this. The thing is that after 30 years of age, the cartilage of the bones start undergoing degenerative changes.
Right.
Now, these changes are not something which we can control. These changes happen with age, and this happens to everybody. Right. So everybody has to undergo that change. It's just that how we can handle it, that is where it matters the most.
Right.
So if you have seen in Indian diets, we are very fond of kachoris and puris and samosas and all that junk, which is high in fats. But in all this process of taste, what we forget is that we are lacking in proteins and nutrients, calciums, which are essential for our body.
True. Yeah.
Now, not only that, the muscles of the body also start to degenerate with age. So all these processes are going to happen to everybody.
Yes.
We can handle it by having a healthy lifestyle, regulating our weight, by developing our muscles or exercising them, at least stimulating them regularly,
Right.
taking good diet including proteins, calciums, which help our muscle and body regenerate.
Right.
And so basically a healthy lifestyle, controlling your weight and regular exercise will go a long way in controlling all those ailments.
Wonderful. Of course, this is these are some of the suggestions that, as you said, all age group should think of.
Absolutely.
Having
yes.
regular exercise in your daily life, keeping yourself away from junk food as much as possible, and
Yes.
intake of proteins and all other stuff to ensure that you're staying healthy for a longer time.
Right.
Absolutely perfect. I totally agree with that. Now, another common question or a common medical terminology that's been heard a lot these days: arthritis and inflammation. Can you please throw some light on how is arthritis considered, to be controlled in somebody's life, or is it something which cannot be controlled at all?
See, when we talk about arthritis or inflammation of the joints, there are basically two types of arthritis.
Right.
One is known as the primary arthritis. Primary means which is age-related arthritis.
Mm-hmm.
As we talked about just now, that there are some things which we cannot control. The cartilage of the bone has to degenerate with time.
Right.
Now, as this process keeps on happening, what happens is the joints start to decay in a way. And that leads to what is known as a primary arthritis or osteoarthritis.
Okay.
There is something known as a secondary arthritis. Secondary arthritis usually happens when there is an underlying condition or some other disease. For example, we must have heard about a disease called Gathia. Now, Gathia by common language which we use is referred to as a gouty arthritis.
Right.
Likewise, there is a thing called as rheumatoid arthritis.
Rheumatoid.
So these arthritis actually go on to affect those joints, and they can lead to something which is known as secondary arthritis. Now these secondary arthritis develop earlier in life as compared to a primary one.
Okay.
So if a person was supposed to get arthritis say around 60-70 years because of age, that person might develop arthritis at 50, 40,
Much
45
earlier.
years of age because of these underlying bone disease. So what happens is that although you cannot really control the primary arthritis, as we discussed, it is age related, so the degeneration has to happen. You can actually prevent its symptoms like pain and decreased mobility by again regular exercises and a healthy lifestyle.
Okay.
On the other hand, the arthritis which are developing due to inflammatory pathologies, those can be managed by some medications, drugs, so that the underlying disease process is subdued and it does not affect the joints as much as it would have if left untreated.
Untreated. Okay. Right. Yes. That's some of the few tips that would
Yes,
really help our
absolutely.
patients. Okay. Now, last but not the least, what would be your key suggestions or tips that you would, give to our students who are looking to face the competitive exams with the topics or chapters related to orthopedics?
So the first tip I would give to the students is be enthusiastic.
Okay.
The second tip I would like to give them is be inquisitive. Do not stop at just the MCQ ka right answer milne pe. Do not stop there. Don't stop at finding out the right answer. Ask why is that the right answer. Ask
Great.
what was the reason behind this answer. Ask why not the other options. And so many other questions. Simply by asking questions, you can learn so much more about a topic which you would have otherwise ignored.
Yes.
Or if you would have marked the right answer and moved on, then you might have ignored the other options which were very close,
Why?
which would have confused you in the exam otherwise. So if you're having a bad day, you should prepare for the worst one.
Absolutely. Okay. So you mean to say having a deeper knowledge about the subject rather than just choosing the multiple choice questions with the right answers
Absolutely.
is not going to help. You would also want the students to know why the other answers are wrong.
Yes.
Right.
So in this process, what happens is you learn much more than what we would have learned by just marking the right answer.
Correct.
So that will go a long way in elaborating that subject for you, that concept for you.
Okay.
Now, as far as orthopedics is concerned, I have seen that there are a lot of image-based questions being asked these days. Now, image-based questions, you should always have a system of approaching them.
Right.
Like if you see an image, how do you want to approach it?
Right.
How do you want to tally it with that clinical history which has been provided in the question?
Mm-hmm.
How should your answer vary if the age of the patient was not 15 but
Okay.
50 years of age?
Right.
How should your answer vary if the pain was not at night time but at daytime? Now these are small nitbit things which, although in a normal flow, you might ignore, but then these are the things which will matter in the examination.
Very true. Yes.
And last but not the least, practice like a lot, because what happens is we all have our bad days, and examination, if you are preparing for an exam which happens once a year, then you should be prepared for your worst one, as I said.
Absolutely.
So the more we practice, the more we try to get into that rhyme and rhythm, the more we try to manage our time accordingly, the better it will be, because we will be better poised to handle that pressure at that point in time.
Perfect. I guess this is where Nextillo app is really going to play a very vital role in terms of having all your suggestions that you told covered under one roof,
Yes.
having the videos covered for the particular topics, and the quizzes related, and the MCQs, question banks, allowing them to get into the printed notes.
Yes.
All these things relatively together is definitely going to help the students to face the competitive exams.
Yes.
So yes, Nextillo is definitely, as we mentioned, a one-stop solution for all the medical competitive exams for all the years.
Absolutely. I think a thorough revision of the notes is quite essential.
Mm-hmm.
We are trying our best to inculcate as much images as we can in our questions. We are trying to be elaborative about them, so that when you see it in the exam, you do not feel like this is the first time ever I have seen that image, now what to do with it.
Right.
So revise your notes, re-revise your notes, look at these images, and lastly, but the most important and vital thing is stay positive, because nothing is as hard as we believe it to be, and once you get into that groove, I am sure you will go on and go through.
Sure, it makes real sense. Yes. Thank you so much, Dr. Pawan, for giving all your valuable thoughts and suggestions to our students, and also throwing light on the interesting facts and hidden things that people were not aware exactly about what orthopedics is all about. Thank you once again, and welcome to the team. And we are eagerly waiting to see all your lectures and have deep knowledge. I'm sure our students are really going to enjoy your lecture.
Thank you so much, Ms. Manjula. It was great to be here. I am sure that I will try and deliver 150% of what I can to help the students go through.
Thank you so much. Pleasure is equally ours. So stay tuned to have more detailed lectures about orthopedics from our renowned faculty, Dr. Pawan Dhawan. And good luck. Thank you.
Thank you.